These are the bills I got from the hospital after discovering that I had cancer. But behind the hospital beds and surgeons who will do anything they can to help, there is a web of financial traps designed to confuse you to the point of absolute exhaustion. And in the worst cases, force you into bankruptcy, all because you're trying to regain your health and get your life back. But these massive bills are actually somewhat of a joke. Let me show you what I mean. To provide some context, I had a tumor in my shoulder and received a complete shoulder replacement, which means I now have a titanium shoulder, and yes, sometimes I do set off the metal detectors at the airport. So let's take a closer look at these numbers. Between my private room for $3,188 and the surgical supplies of $99,559, this bill came out to a total of over $155,000, and this was only one of them. But if you look closer, you'll see that I didn't actually pay $155,000. Instead, my insurance factored in discounts and reductions of about $126,000, which is the first thing we need to cover before we can explain the madness of healthcare. You see, what you have to understand about all of this is the sides that are playing on the field. In general, it's a game of monkey in the middle with you as the patient running back and forth between the hospital and insurance companies, both of which use you and your health as a pawn in their game to extract as much money from each other as possible. To do this, hospitals use something called a chargemaster. It's basically a massive list of prices for every service, drug, and supply a hospital has. But the prices are essentially just made up numbers. And there is really no rhyme or reason to any of it. One hospital might charge $8,000 for a CT scan, while another will only charge $400. Nobody outside of the hospital systems understands how these prices are actually calculated, and hospitals quite frankly refuse to explain it. But how do they get away with this? Doesn't a business need to ground their prices in actual data? Well, hospitals don't need to operate within the normal rules of capitalism that we know. Because unlike walking into a store and seeing a camera that is priced 100 times more than the store across the street, you don't have the option to just head to the other store. Once you're in the ER, there's no competition because the only concern is getting you healthy. And you don't even see the price until well after you've received the care. Take this example of a California mother with a 6-month-old baby. After a rice cooker fell off of her kitchen counter, she brought her severely burned infant to the hospital. The hospital tried to treat her, but were forced to move the baby to another hospital 58 miles away that had the proper equipment. But there was a 7-hour wait for an ambulance, and they refused to allow the mother to drive the baby herself. The doctors insisted on airlifting the baby in a helicopter, which cost nearly $90,000. But the doctors assured her that insurance would pay for it, so there was nothing to worry about. However, a couple months later, she received a bill for $100,000 for the helicopter and the ambulance to get from the helicopter to the new hospital, which was only 0.3 miles away. Now, insurance did pay for some of it, but they left Jessica with a $65,000 bill. Thankfully, Jessica was able to get the news on her side and get the entire bill waived, but that was only after the ambulance company said that the issue still 100% lies with the insurance company deciding to pass part of the bill to the patient. This story is a great example of the monkey in the middle paradox. The hospitals just throw out these crazy numbers to start the negotiation with insurance providers, but the provider will either come back to negotiate them down, as seen in the discounts and reduction tab of my bill, or they'll just pass the bill down to the patient, forcing you to spend years going back and forth between all of the entities involved just to keep yourself from going broke. But that's only the beginning of this web of lies. Because just like the auto repairman selling you on more blinker fluid, hospitals will often focus more on profitability than actually providing the best care. But just like your personal health requires taking care of, so does your Mac's health. And that's why I'm excited to share today's sponsor, Clean My Mac. If you use your Mac on a daily basis like I do, you know how fast your storage can fill up with useless and random downloads or project files. And in the past, I would manually go in and try to clean out my unused files, but with 2 full terabytes of memory on my MacBook, that is a lot easier said than done, which is why I love using Clean My Mac. Instead of having to go out and upgrade my computer to get more memory, I can speed the entire computer up simply by cleaning and optimizing my current setup. Clean My Mac is incredibly simple to use, and you will notice an immediate improvement in the speed once you clean up all of those useless files. One of my favorite features is the space lens. It maps all of your folders as different sized bubbles depending on how much space they're taking up, which makes it easy to find all of those useless files that have been hiding for months. Or just use the cleanup feature to remove duplicate files, unused documents, or random update files that different apps on your computers might download. I can't recommend Clean My Mac enough, and it's brands like them that allow me to make these videos for you to enjoy. So use my code RUDO at checkout for 20% off Clean My Mac and a 7-day free trial. Thank you again to Clean My Mac for sponsoring today's video. Now I'll take you back to the problem with hospital systems. In order to understand the mechanics behind all of this, you have to understand the business model. Within the healthcare system, the patient is actually the product. In most businesses, we are the customers, and the businesses are forced to optimize for customer satisfaction with the hopes of turning us into repeat buyers. But in healthcare, the patient isn't actually the customer. The real customers are the insurance companies, employers, and government payers. And the patient is basically being sold to these third-party payers. The hospital's job is to optimize each patient interaction for maximum revenue, which means more tests, more procedures, and more billing codes. And the more services performed, the more revenue comes in the door, which is illustrated perfectly by the boom in spinal fusion surgeries throughout the early 2000s. Between 1998 and 2008, the number of spinal fusion procedures increased by 137%, while other similar surgeries like hip and knee replacements saw a much smaller increase. Was this because more people were experiencing back pain all of a sudden? Not necessarily. Spinal fusion surgeries were some of the most profitable procedures performed at hospitals, and everyone was getting a piece of the action. Instead of a surgeon recommending a patient with back pain to rest or go see a physical therapist, they could instead elect them for spinal fusion, which averaged $50,000 to $80,000 per admission. And that led to the multi-billion-dollar market of spinal implants. In fact, the Lown Institute performed a study on the overuse of back surgery and found that over the course of 3 years, US hospitals performed more than 200,000 unnecessary back surgeries on Medicare patients, which was equivalent to one surgery every 8 minutes and about $2 billion in Medicare costs. But even if hospitals and surgeons really were aligned with patients and weren't performing useless surgeries just to bump the ticket price up, would that solve the problem? I wish that were the case, but there are more players on the field than we discussed before. As you already know, the insurance companies add a massive level of bureaucracy to the US healthcare system. In fact, about 18 to 25% of US healthcare spending goes directly to administration costs. Administration costs are things like the massive billing departments at the hospital and the thousands of employees around the country that have the job of negotiating with all of the insurance providers. But they're not the only ones clogging up the system. We also have pharmacy benefit managers, or PBMs. When a pharmaceutical company tries to sell a new drug, they'll set the list price of that drug, and then a PBM will step in to negotiate on behalf of insurers, employers, and government programs like Medicare. The PBM will then decide which drugs get on the list of covered medication that the insurance companies will reimburse pharmacies for. But if you think that the PBMs are there to keep the price down, you'd be wrong. PBMs make money on rebates and spread pricing. Basically, when a drug company sets a high listing price, the PBM isn't negotiating for a lower price, they're negotiating for a rebate for the insurer. But that rebate is usually a percentage of the list price. So the higher the sticker price of the drug, the bigger the rebate, and the more the PBM gets to keep, which means they're actually incentivized to prefer a higher priced drug over a cheaper generic because they can make more on the spread. But beyond the PBMs, you also have medical device makers and equipment distributors who are accompanied by vendors, other distributors, and group purchasing organizations who all want their cut of the pie too. And for every layer added to the system, the price that you and I pay climbs higher and higher. But as the price climbs higher and higher, we receive less and less information. Since January 1st of 2021, all hospitals are required to post a machine-readable file with all standard charges and a consumer-friendly display of shoppable services. Along with that, insurers are required to give you a live estimate of services based on the billing code you receive from the hospital. These laws were all created in an effort to promote more transparency and prevent massive bills from surprising you in your mailbox. But compliance of these rules is a different story. Most of the time, time, hospitals will dump billing codes and prices into massive lists that are almost impossible for us to decipher. And as we learned earlier, these prices aren't even the real prices. They're just starting points for their negotiation with the insurance companies. But some might argue that by doing so, the hospitals aren't meeting the requirements of price transparency. And frankly, they would be right. But the hospitals don't really care. Some hospital systems were fined over $2 million per year for their lack of transparency. But when you consider the fact that most of these large hospitals operate with revenue numbers well over $20 to $30 billion, that $2 million is a tiny drop in the bucket to keep the system humming along nicely. And although laws like price transparency are helping to make healthcare more affordable, there are massive forces pushing back at every step. In fact, in 2025, the healthcare industry spent nearly $429 million on lobbying, which is more than the defense, oil and gas, and finance industries combined. Over 1,500 lobbyists work on Capitol Hill exclusively for healthcare, pressuring Congress to make decisions in the best interest of Big Pharma and not the citizens. For example, the No Surprises Act that was passed in January of 2022 was meant to prevent patients from receiving ridiculous out-of-network bills when receiving emergency care. But private equity-backed staffing firms spent millions of dollars lobbying against it. So although we got a new law to prevent surprise bills, there were a lot of loopholes left open to keep the practice profitable for these healthcare companies, meaning that the endless lobbying on Capitol Hill not only keeps new competitors out, but it ensures that Congress won't really do anything to stop Big Pharma from doing anything they please. And something that Big Pharma loves to do is charge Americans insane prices for drugs. In fact, the US pays 2 to 4 times more than other wealthy countries for the exact same drugs, mainly because the pharmaceutical companies, PBMs, and regulators have built a pricing system that rewards higher list prices and delays competition. One of their favorite things to do is called patent evergreening. Basically, drug companies will make minor changes to existing drugs. This could be a new coating on a pill, the dosage form, or changing from a pill to a liquid. By doing this, they are allowed to file a new patent, which extends the life of their original drug and blocks the generic competition from joining the market. This is exactly why insulin patents have been extended over and over for decades with barely any innovation. But even if a patent does expire, sometimes brand name manufacturers will just pay the generic competitors to delay launching their cheaper alternatives. And the FTC estimates that these pay-to-delay deals cost US consumers billions of dollars per year from higher drug prices. In 2009, a 2-pack of EpiPens would run you about $100. But by 2016, the same 2-pack was $600. And as the price surged, the public decided that enough was enough. After protests, congressional meetings, and lawsuits filed all over the country, Mylan, who was the maker of the EpiPen, agreed to a $465 million settlement in 2016 for misclassifying the EpiPen as a generic drug. By labeling it a generic, they could pay lower rebates to Medicaid, which made EpiPens even more profitable for Mylan. And most recently, in 2025, they agreed to a $73.5 million settlement in a case alleging that Mylan and Pfizer conspired to delay the launch of a generic EpiPen. Keep in mind, the $600 2-pack EpiPens only cost about $70 to produce. So no matter what argument they make, it doesn't make sense that the price increased from $100 to $600 over 10 years without any rising costs.
You know, we've talked about this. I mean, you need competition.
Maybe you just need morals.
That doesn't really...
Who other than the CEO, the board, and shareholders of Mylan look at the price hikes and the ridiculously exorbitant price of the EpiPen and say that that's cool. That's capitalism at its best.
The EpiPen is just one example of the insane price gouging we see across the medical industry. And frankly, it is way worse when you look at things like cancer therapies, which often launch at prices well over $80,000 per year. But without the ability to negotiate prices on our own, we're left to the wind of whatever these drug companies and PBMs decide. And insurance isn't exactly on our side either. Although it was originally intended to protect consumers from high cost, it's become one of the main reasons for the high prices. You see, health insurance was originally created to cover rare and catastrophic events. But today, insurance has expanded and we're using it for things it was never meant for. From routine checkups to predictable expenses like blood tests and prescriptions, the more we use it, the less helpful it becomes. When using it for simple things, it makes the patient less sensitive to the prices because after all, insurance is paying for it. But as premiums steadily increase year over year and deductibles rise at the same rate, we are all paying more for insurance than we actually realize. Even if your employer is paying for most of your premium, you're still losing out through lower wages, which makes insurance kind of like swiping a credit card. You're not paying the price today, so you don't feel the pain of overspending immediately. I mean, think how different a trip to the doctor would be if they showed you the cost of all the tests and scans before you got them done. You'd probably be a lot more selective in the tests you do, or you'd be more open to receiving a second opinion. But our legal system doesn't help at all when it comes to this kind of thing, mainly because as a society, we have become so over litigious that people are afraid to do anything that might land them in a courtroom. And the easiest way to avoid a malpractice suit is to order every test possible, perform the most aggressive procedures, and admit you to the hospital for the smallest reason, which all drive the cost sky high with very little added benefit to the patient outside of one-off cases. But this practice of defensive medicine is almost driven by the patients. They want more testing because they equate it to better care. So the doctor will happily oblige because they don't want to be accused of anything if they fail to diagnose or treat the patient, all while the bills stack up in the background while everyone assumes it's the insurance company's problem to take care of. But as we know from earlier, they'll find any way possible to dump that cost back onto you, the patient, whether you ask for extra testing or not. And these extra tests, of course, mean more revenue for the hospitals, which is exactly why investors have started to join the party. You see, back in the day, hospitals were run by doctors and medical professionals. They were either small private practices or groups that got together to serve patients. But now, private equity firms and corporate investors are starting to buy up hospitals, nursing homes, ER staffing companies, and specialty clinics. Not necessarily with the goal of improving patient care, but instead they're looking to cut costs, maximize revenue, and then flip it for a profit, which leads to worse care, higher costs, and way more aggressive billing. One of the worst cases of PE investments in healthcare lies in the nursing homes all over America. In fact, some studies have shown mortality rates actually increase after private equity takeovers, mainly because the PE firms strip the nursing homes of staff in order to lower the costs. But with less staff, the patients receive less care, and one thing leads to the next, and you're left with a 10% higher mortality rate in the years after a PE acquisition. But PE firms don't just target nursing homes. They're also going after community hospitals and consolidating or completely removing the low profit services provided like rural emergency care. And the main problem with all this is that PE firms operate on a 3 to 7 year timeline. They don't really care about patient satisfaction or what happens after they pull out of the community. Instead, they're focusing on maximizing profitability at all costs so that they can flip their asset to another buyer in a few years, which is completely against what healthcare should be. But with all that said, the question is the system broken or is it working exactly as expected? Based on everything I learned while making this video, I would say that this is all working according to plan. The complexity and confusion of the billing codes, the in-network versus out-of-network decisions, and all the jargon insurance companies will throw at you are there to protect the profit of the healthcare industry. As a whole, the system is engineered to provide you with the least amount of leverage in your most desperate times. Because when you're sick, the only thing you care about is getting healthy, no matter the cost, and these companies know that. As their profit grows, they fund more lobbying and pass more laws to protect their money train from ever running off the track. It's an endless cycle that doesn't have a real end in sight. After all, these are some of the biggest companies in the world, and they control our health and our lives. So I don't really know where we go from here. The only thing I do know is that if you can live a healthy lifestyle, you have the potential to break away from the system. And as we learned, just because you have insurance doesn't necessarily mean you're going to spend less on your healthcare. Because if you're a healthy individual, you probably won't use the doctor as much, but you're still paying hundreds or sometimes thousands of dollars a month for health insurance. I've seen firsthand that paying out of pocket for MRIs, blood work, or other tests is way cheaper than billing it through insurance. So just take the time to ask your doctor, and if something seems incredibly overpriced, feel free to go and get a second opinion. Because as always, the more information you have, the better decisions you can make. If you like this video, YouTube thinks you also might like this one. So let's see if they're right.